Welcome to the Heart Talk, a podcast dedicated to empowering you with the knowledge and habits that keep your heart strong and healthy. In today's fast paced world, where stress is high, lifestyles are sedentary, and processed foods often replace wholesome meals, heart disease has become one of the world's leading health concerns. And alarmingly, it's affecting younger people more than ever before. Hi, I'm Huma Qureshi, and in this episode, we're joined by a leading physician to help us understand how we can protect our hearts, detect early warning signs, and make choices that ensure a longer, healthier life. Together, we break down the science into simple, actionable steps that you can start today, because a healthier heart means a healthier you. So, doctor, tell me, why are so many people today, younger people, even celebrities, getting heart attacks at just 40? I mean, aren't heart problems for older people?
Thank you, Huma ji. मैं हूँ डॉक्टर अंजलि शर्मा and it's really an interesting question in the present world. As we have seen, the initially in the previous year, the heart attack is known to be a disease of older individual. But in the present scenario, we have seen so many young individuals getting heart attack at very younger age group. The data shows around 25% individuals are very young. They are less than 40 years when they get their first heart attack. Especially the South Asian population are prone to have the heart attack at the younger individuals. This is because of the presence of risk factors like diabetes, obesity, smoking, and high stress level. Even the individual who looks fit can have the underlying hidden risk factors for like high cholesterol level, like genetic predisposition. So these are the conditions which make a young individual prone to have heart attack even at very younger age group like less than 40 years of age.
So, what are the warning signs that I should never ignore when it comes to my heart? And when should I see a doctor?
So there are certain warning signs which we should never ignore. Like if anybody has complaint of chest pain or chest heaviness, and especially if the pain radiates to the arm, left arm, right arm, it radiates to the jaw or back or neck. If a patient complains of dyspnea, that is shortness of breath, if patient complains of fatigue, that is disproportion to the work, and if the patient has palpitation, dizziness, fainting, so these symptoms should never be ignored because delay in the treatment will increase the mortality significantly. Early detection can save a life.
And what are the most important daily habits that people can adopt to keep their heart healthy and to reduce the risk of heart disease? And what are the daily habits that people can use to keep their heart healthy and reduce the risk of heart disease?
So important daily habits which keeps the heart healthy, which reduces the risk of heart disease is the lifestyle modification. Lifestyle modification include healthy diet and exercise. The diet which is rich in fruits, vegetable, lean protein, whole grains, and exercise. We should, if we are doing moderate exercise, do at least 150 minutes per week. And if we are doing vigorous exercise, do at least 75 minutes per week. Quit smoking, reduce alcohol use, maintain your weight, regular checkup of the blood pressure, blood sugar, regular screening for the age 30 years, those who has high risk categories.
How much do diet and physical activity actually affect your heart health, and what are your top recommendations?
So the diet and the physical activity really play a very important role in the heart health. Even up to 80% of premature heart disease is preventable with a healthy diet and exercise only. I recommend Mediterranean and DASH type of diet, which reduces the cardiovascular risk significantly. Regular activity improves our blood cholesterol level, it improves the blood pressure, and it increases the insulin sensitivity. But do remember, consistency is more important than intensity.
What about stress? Does stress actually affect the heart, and what are the practical steps that one can take to reduce it?
So yes, Humaji, the stress management is really very important because chronic stress increases the blood pressure, it increases the inflammation and risk of arrhythmias. Stress-related heart disease are well documented in the young professional also. So some of the techniques which I recommend like mindfulness, yoga practices, meditation, deep breathing exercises, adequate sleeps are important to and they are helpful in managing the stress level. Also, we should develop the more social connections. And if somebody needs, counseling is equally important to reduce the stress burden.
Well, as we wrap up today's conversation, remember your heart's health is in your hands. Every small change you make, from the food you eat, the way you move, and how you manage stress, adds up to a stronger, longer life. We hope the insights have inspired you to take those steps starting today. After all, your heart works for you 24/7. It deserves the same care and commitment from you. Thank you for tuning in. Until next time, keep your heart happy and it will keep you going strong.